The Senate Committee on Health and Human Services will come to order. We've already established a quorum, members, and so we will begin where we ended this morning. The chair lays out Senate Bill 2143 and recognizes its author, Senator Parker, to explain the bill. Thank you, Senator. Glad to have you back in Health and Human. I know this morning you came in and we were voting, and so my apologies for not getting you before the break.
Oh, Madam Chair, you're too kind. Thank you. You guys have been working, taking care of so many critically important policy initiatives for Texas. So thank you very much for accommodating me this afternoon and allow me, Madam Chair, to come before you and the members to lay out Senate Bill 2143. There will be a committee substitute on this bill, as there was some significant drafting errors in the original bill that did not meet the intent of the bill. Therefore, I will lay this out as it was intended to have no confusion, and we will bring the substitute when it has been completed by Leg Counsel. Families with a medically fragile child seek critical medical supports and services by adding their child's name to an interest list for a specialized home and community-based services Medicaid Waiver program known as the Medically Dependent Children's Program, or MDCP. The program currently serves around 6,000 children. The wait list can take upwards of 5 years and currently has more than 5,842 children on the list for services as of February 2023. MDCP provides support services to medically dependent children who are medically dependent based upon medical need to encourage get them out of institutions and allow children and young adults who reside in nursing facilities or require a nursing facility level of care to remain in the community. Texas is the only state with a significant wait list for home and community-based services for the medically fragile. The committee substitute will make it clear that the intent is not to create new waiver slots, but rather to address the allocation of the existing slots. Senate Bill 2143 would decrease the waiting list 3 ways. First, it will eliminate the overnight nursing home stay requirement for program eligibility through the federal Money Follows the Person demonstration project. Second, Senate Bill 2143 would allow medically fragile children who are accessing the STAR Kids program through disability eligibility for SSI to be assessed for and transition to MDCP if they meet the medical necessity criteria for nursing facility level of care. This will match the current policy for adults with disabilities under STAR Plus, the Adult HCBS Waiver Program. The goal of this is to keep care consistent for medically fragile children and reduce the interest list. And lastly, Senate Bill 2143 will further reduce the HCBS interest list by aligning the financial eligibility for the Texas Home Living HCBS waiver so that it matches other Texas HCBS waivers, allowing children with disabilities who meet the eligibility requirements to access the lower cost tiered waiver in lieu of more costly comprehensive waiver services, and removes the IQ requirement. Texas HML is currently the only Texas HCBS waiver which does not utilize the special income provision for home and community-based service waivers. Madam Chair, obviously, this is something I've been passionate about for a long time. Senator Perry and I have worked on this topic over the years and believe it's very important that we have a serious discussion about the need to address this population of 6,000 children in a unique way. And so with that, I appreciate you allowing me to come forward and talk about how we take care of the most vulnerable in our society.
Yeah, thank you, Senator. Of course, we don't have wait lists in Texas. We have interest lists. And we had a very long discussion about that in Article 2 work group, where I know Senator Hughes was with us. And so just a quick question on this. If this bill were enacted, would this give MDCP, would they jump other people on the interest list?
So,
and we can ask HHSC.
Sure, and they'll give you their technical response. I mean, basically what we're doing, we're not obviously adding slots. We're trying to create greater efficiencies within the current slots that are available to us. And so, you know, if you have some of these situations where you have someone that can get care at home, and they can financially afford to do so, then they can be, free up a more expensive slot, if you will, for someone who's on that interest list to be able to obviously accelerate the rate with which they get access. So I'll let Health and Human Services talk about that in more detail, but that's really the intent of what we're trying to do, is just be the most efficient and effective we can with the slots that we have, and recognize that not all cases are the same, right? You have different degrees of challenge and different degrees of ability, that some can do more home-based care than others. And so that's really what we're trying to accomplish.
And so on the interest list, I know I always ask this when we're doing the budget and stuff, but if you qualify, I mean, you're getting services. You might be in Star Plus, you're getting services. You might be waiting for what we would call a more comprehensive waiver slot, but that you are receiving some. And obviously we look at that interest list this session. I know on the Senate side, we're reducing it to a large not as much as I want, because what we did with the raises for community attendance and things is really interesting. It's going to make it more expensive. So when we thought we were getting this many slots, actually by giving community attendance more money, we're going to reduce the number of slots, because it's just a cost factor, right? Even though we upped the amount of money that we were going to do on slots. And so,
and thank you for your leadership on that for all these years.
It's tough. We're
very engaged and passionate on this topic for a long time, as well as all the members of the committee have been that have served previously.
Some of those interest lists are large. I know we're trying to. We have a good, I think, writer that again looks to address it and make sure that we're doing a better job to assess that interest list. And of all the interest lists, MDCP is the smallest. That's the good news. That is the good news, is that it's the smallest number. The last time I was, we were working on Article 2, which we're about to start working on again. So with that, I know we have some invited testimony. Elizabeth Tucker. And while we're waiting, I was going to ask HHSC to come up. I'm not sure who we have. Yep. Great.
Good afternoon.
Welcome. State your name for the record.
Thank you. I'm Elizabeth Tucker. I'm the executive director of a small statewide nonprofit called Every Child. We have been charged with the development of family-based alternatives to the institutionalization of children with developmental disabilities. Over the years, we've helped 820 kids leave facilities and move back home to family, or to live in a family-based alternative with another family that's sharing in the care of the child. 244 of those children left nursing facilities and were medically fragile. So I want to thank Senator Parker for sponsoring this bill. I think it's a really good bill. I've been at this since 1984, trying to effect change and working hand in hand with the Health and Human Services Commission to make recommendations to them that were not only cost effective, but made sense to the people of Texas. I have assisted families and have heard struggles and know what happens when a child, even at birth, gets placed in a nursing facility, sometimes 5 hours away from home. The elements of this bill are included in multiple advisory committee recommendations. They're in the Policy Council for Children and Families recommendations. They're in the IDD System Redesign Advisory Committee recommendations. They're in the IDD Strategic Plan. They're in the Star Kids Advisory Committee. So they're recommendations that are well thought out and have been talked about for many years by groups that are really struggling and working with children. So right now, in order to get for a medically fragile child who has a trach, is on a ventilator, has been in a NICU for 2 solid years of their life, and they do not have Medicaid, the only way for them to get the services that they need upon discharge is to take an ambulance ride to a nursing facility, to pay a fee for the nursing facility for an overnight stay, and then to do their time in the nursing facility to then go home with those supports and services. There are people, Senator whole course. I was glad you brought this up. There are some children that are getting services already that are on the medically dependent children's program, but about 60% of them are not getting services. They do not qualify. They don't qualify for Medicaid buy-in. They don't qualify for any services, and the costs of the children are really astronomical. So those that have SSI and have Medicaid may be getting services, but the others are not. So this bill will stop that kind of practice of overnight stay in a nursing facility that's not only costly, but it's devastating to their families. It doesn't make a lot of sense to the system. I get calls all the time from hospitals trying to discharge kids that they're having to keep 2 or 3 months longer than they need to keep them because they can't get services to the child in the home. They're saying, why is this the case? And it's the system. The bill also creates the thing that almost eliminated the STAR Plus interest list, and that is the state's practice of allowing people who met medical necessity for that STAR Plus nursing facility waiver immediate access to the waiver if they had SSI. That's what cut that STAR Plus interest list down to 6 months. We're asking for the same consideration for the children that are in the medically dependent children's program. So those who have SSI and meet that eligibility should get that with no wait, similar to what happened with STAR Plus. It's a cost-effective way to do it, and it would reduce that interest list by those people that have SSI. And finally, the Texas Home Living waiver is the lowest tiered waiver. It's the lowest cost waiver. And it doesn't make any sense that the eligibility criteria for that waiver is more stringent than the others, because you would seem like you'd want to serve people in a lower tiered waiver as opposed to some of the more comprehensive waivers. And so this bill would just allow for the same financial eligibility criteria that's applied in the other waivers to be applied in this waiver as well. And I think that makes good sense. 1 year ago, there were 55 children and young adults in Texas nursing facilities. Today, there are 77. The system people are really struggling, and they're desperate for services, and so children as young as 2, 3, 4 months old are going into nursing facilities. Sometimes their families are far away from them. It's very difficult. Again, children are staying long times in the NICUs. This bill is not just going to help those families get critical access to services. It's ultimately going to save the state dollars. It's going to save the state dollars in not doing long-term institutionalization of those children, and it's going to save the state dollars by not having prolonged hospitalizations of those children. Been working a long time with kids, getting them out of nursing facilities. The longer a child stays, the less likely they are to leave. So I thank you all for your commitment, and I thank you, Senator Parker, for bringing this forward and for the committee really listening to it, because it's about time we did something to kind of try to fix the system, and I think we have an opportunity.
Members, any questions? Senator, no. Thank you. That was very good explanation. I know, Stephanie, you're here. Can you explain, first of all, say your name for the record?
Stephanie Stevens, State Medicaid Director.